You're good.
All right, so these are going to be the special tests for the knee. Okay, the first test that we're going to do is the valgus stress test. The valgus stress test is going to be stressing the MCL, okay, our medial collateral ligament. All right, so I'm going to actually have Trey move so that he's closer to the edge of the table. And I know he has a really big leg, but we can still do this, okay? You're going to have a supportive hand, and then you're going to have a hand that's actually doing the movement. So I'm left-handed. You're going to have to learn how to do this on both sides. So I'm going to support his lower leg. My right hand is going to be right at his joint line on the lateral side, okay? He's going to have his leg straight, so it's going to be at 0 degrees. I am going to push with my right hand towards the medial side, and then his lower leg is going to come towards me, okay? So it's a push, okay, push, and then slightly bend the knee, and then you're going to do it again. You should feel a stopping point. Okay, that's for the MCL, that is the valgus stress test. So now to do the Varus stress test, so on the LCL, our lateral collateral ligament, I'm going to swing Trey's leg out. So I'm standing on the inside of his leg. I'm bracing his lower leg against my body. My left hand is going to be where his MCL is. Leg is straight, okay? Again, I'm going to make a force, a Varus force that's pushing outward. So push out. Put a bend in the knee, push out again. Okay, bent, push, straight, push. Again, testing the lateral collateral ligament or the LCL. The next test that I'm going to do is called the Lachman's test. Remember, this is for the ACL, which is under the patella, deep in the knee, all right? Trey's leg's really big. We can still do this, okay? My left hand is going to be below the patella on his tibia, okay? My right hand is going to be on his quad, okay, above the patella, and I'm going to have him relax. The motion is my left hand, so his lower leg is going to come up. My right hand that's on his upper thigh is going to go down. Okay, like an opposite movement. So I'm going to have him relax, go down, or pull up with my left, down with my right, up with my left, down with my right, okay? It is pretty hard to do that even with my small hands. So a way to adjust it is that I can put my knee under his quad, or under his hamstring. I can put this hand, my right hand on top, my left hand on the bottom, and I can do the test again to see if I can get the movement in the ACL. Next test after that for the ACL again is going to be the anterior drawer. So we're going to bend the knee so that his foot's on the table. I'm going to sit on his foot. I'm going to relax his hamstrings, and then I'm going to take my fingers and I'm going to cup them right behind the knee. My thumbs are going to be on the joint line, so they're actually going to be next to the patellar tendon, okay? And then I'm going to pull straight towards me. So his hamstrings are relaxed, my thumbs are right next to the patellar tendons, I'm sitting on his foot, and I'm going to pull straight towards me. You should feel a thunk. If you don't feel a thunk, we might have a loosey-goosey ACL, okay? The next test we're going to do is called the Varus Test, which is actually kind of easy. I'm going to take my left fist. I'm going to put my left fist under Trey's calf, okay, under the medius part of his calf. My right hand is going to go above his patella. What I'm going to do is I want to see if I can get his foot to kick out. So I'm going to push down on his quad and hope that his knee kicks out or his foot pops up, which it does. That means that his ACL is intact. The next test we're going to do is McMurry's test. This is going to be for our meniscus, okay? This test is a little funky, but it's all right. you're going to lift the leg up and it's going to be bent. My left hand is going to be on his heel, okay? I'm going to put my fingers so that they're on the joint line, okay? I'm going to bring his foot towards me, okay? And then I'm going to straighten his leg out. Bring it back up. Now I'm going to push his foot away from me and then straighten his leg out. If he has any popping, clicking, grinding, or pain with that, that means there may or may not be an issue that needs a tissue with their meniscus, okay? The last test that I'm going to have him do is I want you to lay on your stomach. This is called the compression and distraction test. So I'm going to get on the table. I'm going to bend his knee. I'm going to put both my hands, even my weight, on the top of Trey's foot. I'm going to push down and I'm going to twist back and forth. If he has pain with that, we may or may not be dealing with a meniscus issue. That's the compression portion. Distraction, I'm just going to put my knee on the back of his hamstring. I'm not applying weight, it's just more for a bracing, to brace him down. I'm going to put my hands under his foot. I'm going to lift up, and then I'm going to do the same motion again, where I'm lifting up and twisting back and forth. If he has pain when I lift up in a distraction and I'm twisting back and forth, it's not a meniscus issue. It could be a ligament issue.